Welcome to this video on brain death, pathophysiology, and confirmation. I'm Dr. Nasser Hassan, an emergency medicine consultant. We will begin by discussing the pathophysiology of brain death. The ischemic cascade starts with metabolic collapse and ATP depletion, leading to cytotoxic edema. As the brain swells within the skull, intracranial pressure, or ICP, rises exponentially. The mechanism of cessation occurs when ICP equals the mean arterial pressure, causing cerebral perfusion pressure to reach zero. This results in global cerebral infarction through the final common pathway of herniation and loss of homeostatic control. Next, let's review the clinical confirmation criteria for brain death. Essential prerequisites include an irreversible cause, compatible with brain death, normothermia, hemodynamic stability, and toxicology clearance. These conditions must be met to ensure that external factors are not masking brain function. The brainstem reflex examination involves checking for fixed pupils, the absence of eye movement during cold calorics, and the absence of gag and cough reflexes upon suctioning. The apnea test observes for spontaneous respiratory effort for 8 to 10 minutes. The test is positive if the PaCO2 exceeds 60 mm of mercury, or 20 mm of mercury above baseline, without any spontaneous breaths. Ancillary testing is used when the clinical exam or apnea test cannot be safely performed. Gold standard imaging, such as cerebral angiography, shows a hollow skull sign. EEG must demonstrate electrocerebral silence for at least 30 minutes. It is important to consider the differential diagnosis and mimics, such as locked-in syndrome, Guillain-Barré, drug intoxication, and hypothermia, which require different management approaches. The legal and ethical framework states that brain death is legally equivalent to death. Precise documentation of prerequisites, 2 clinical exams, and apnea results is mandatory. Thank you for watching this video. For more information, you can contact me via email or reference the included textbooks. These are the sources for the images used throughout this video.